I'm just going to welcome people as they come in. And also going to start the Facebook. So welcome everyone to this webinar. We're starting in 4 minutes and we're just getting ready for you. So thank you, make yourself comfortable in front of your computer screen or your phone or your tablet, whatever the case may be. And thank you, Mumtaz Ali, for raising your hand. And you're welcome to use the chat to introduce yourself. I'll be sharing some of the ground rules very soon. So just sit tight. We're ready to kick off. We'll be kicking off at the top of the hour. Whatever the time may be, good morning, good afternoon, or good evening, whatever's appropriate. We're very happy to welcome you here. So I want to welcome everyone from Geneva, Switzerland. We're getting ready to start in 3 minutes, so make yourselves comfortable. Make sure your headset is working properly, that you can see the slide that is being shared on screen. And we'll be right with you. We're getting the Facebook live stream started alongside the Zoom room. If you have colleagues who'd like to watch on the Facebook, they're welcome to. There's no limit to the number of participants for that. So you are very welcome, and we'll be getting started in just 2 minutes.
This is Samir. Have fun, Emily and Aaron.
Thank you. And that was Samir Soda, who presented the first webinar yesterday. For those of you who are with us, we hope that you are returning for more. I also recognize the names of many scholars, scholar alumni, as well as scholars who are beginning, who are onboarding for the new course on reducing inequities and improving coverage. So we'll be getting started in about just about 1 minute. So thank you for your for joining early, and a warm welcome to Mohamed Bounbida, to Bonome Desiree and Turo, Cartini Gadroen, Juan Hernandez. We've got Jordan, Sierra Leone, Belgium, Ghana, Zambia, Nigeria, Tanzania, many countries, Canada, Ethiopia, Baltimore. So we really want to, again, warmly welcome you here. All right, it is now 2 p.m., 1400 hours in Geneva, Switzerland. And very pleased to welcome you to this open webinar series. This is the second of 6 webinars that we are organizing. With me from Geneva, Switzerland, our number of staff from the World Health Organization, our lead presenter, Emily Witten, welcome, as well as Jill Milbal, who's responsible for capacity building for immunization, and Samir Soda, who is our lead presenter yesterday. Joining us from Atlanta, from the Centers for Disease Control, is Aaron S. Wallace. So I want to welcome you as well to the to this webinar, and he'll be presenting alongside with Emily. So quick review of the ground rules and how this webinar is going to work. If you were here yesterday, the rules have not changed. If this is your first time joining, please have a look. We'd like you to start by typing the city and country names. So I'm going to do it myself. To go to the, if you can find your way to the chat window, you'll see an item named chat, C-H-A-T. Go there and type in the city and country that you are connecting from. And of course, there are already many people who have done so without needing to be prompted. Second, the most common recurring question in this webinar is likely to be, how do I get the slide deck? Will you make the resources available? So the answer is unambiguously yes. And in fact, we've prepared a Dropbox folder. So via the link I've just typed into the chat and that my colleague Vasiliki Morgela has just retyped, you can get access to the slide deck for today's session already, so you can follow along if you have bandwidth issues. And definitely, you do not need to ask that question. WHO has already shared the guideline that is the main topic of discussion today. You'll find it on the WHO website, and we're making it available especially for you via this folder. WHO has used the scholar approach, a package of interventions to support country level action planning and capability development since 2016. This open webinar series is part of this package, recognizing that countries may need support to plan and implement strategies and activities included in the guidelines. Now, if you're here today, I'd like to strongly encourage you to consider that this is a series of webinars. And if you want to get the greatest benefit from what the World Health Organization is offering through this series, and to get the information you need to determine if and how these guidelines, these global guidelines, can be useful to your work, you're strongly encouraged to be regular in your attendance and to join and to participate in each of these sessions. You can see the next dates. So we had 2 webinars back to back, yesterday and today, but the next one is 11 days away. So make sure you have that in your calendar so that you do not miss this important event. This will be on urban immunization and reducing inequities in that specific context with a colleague, Godwin Mindra from UNICEF. Now, last piece of information I'm going to share with you. You should see that we already have 5 questions. If you look at the bottom of your Zoom window, you'll see a number of icons. One of them is called Q&A, so the letter Q and the letter A. If you click on that, you'll discover that you can actually ask the question that matters to you to the presenters in this webinar. So because we are so numerous, I would encourage you to first look, has somebody else asked the question that I would like to ask? And if so, then look for the little hand with a raised thumb and click or tap there, because that is how you can show that you are voting for the question. And we will answer the questions that collect at least 20 upvotes. So a question, no matter how good it is, needs at least 20 votes. So focus on voting for questions, even if I know you're going to be focusing primarily on the substance of the presentation. So that is the Q&A. You've already discovered the chat and are introducing yourselves there. There's a third tool in this that we will be using in this webinar. And these are the polls. So this is really an opportunity for you to tell us something about yourself, and we're going to do it right away because I'm going to ask you, I'm going to put up a poll, and you're going to look at the questions. The first one is, you can see here, at what level of the immunization system do you mainly work? And here are the instructions. You need to tap on the correct answer for you, and then click on next, because we have 3 questions in this first poll. Do your best to answer as quickly as you can, and and then once enough people have answered, we'll share the results. So if you are ready, here we go. I'm going to launch the poll, and now you should see on your screen a set of options. And again, you'll need to answer all 3 questions before we see any of the results. So you should see on your screen, welcome to the webinar. And the first question is, at what level of the immunization system do you mainly work? All right, we have 5 people who've figured out how to do it. Thank you. And now we have 14. If you don't see it, especially if this is your first time in such a webinar, don't panic, it's okay. The options are there, you just need to look for them. And certainly we're seeing we're seeing, okay, we've had more than 100 people answer. Let's just keep going until we get at least half of the participants. And while we do that, we're having, we're getting the, we're also looking at what people are saying. If you are watching us on Facebook, you will not be able to vote, but you can certainly use the commenting on the Facebook page to let us know that, you know, how you feel and how you respond to these questions. So I will be keeping an eye on the Facebook comments and questions as well. All right, so we now have almost 300 people who have voted. Please keep going. If you're just joining the session now, you should see in front of you a poll, and we need you to answer all 3 questions in order to to progress with the session. And I think we're going to be, all right, a few more seconds. So last chance to participate in the poll. This is to give Emily Wooten and her colleague from the CDC a sense of who is in the room. Tell us a little bit about yourself. Once we end the poll, you can, of course, return to the questions. Of course, please listen to Emily's presentation first and then determine what questions you want to ask. All right, so I'm going to close the poll now and share the results with you. And in today's session, we see that a third of participants, 36% are from the district level, a third from the zone, the region, and subnational level, almost 30% from the national level. And then we have the 2 other questions. I'm going to turn to Emily to ask for her thoughts, a reaction, a response to these poll results.
Thanks very much, Rada. Yeah, no, very interesting to see where all of the participants are coming from in terms of the countries, and then now also in terms of the split. So we see a lot of people working at the district or the zone or region, the subnational levels. So more than half of the participants at that level, 28% at the national level, and then a much smaller percentage at the regional and global level. I'm pleased that a lot of people have heard about integration already. So 73% have heard about it, and a big 25% have already had a look at the resource guide. So that's really impressive. And I'm hoping that the rest will be motivated to look at the resource guide after today's webinar. Super impressed to see that 95% of people already believe integration is important in their current work. So hope we'll be able to reinforce that message today and continue that interest.
Great, thank you very much indeed, Emily. So I'm going to stop sharing the poll and hand control of the screen now over to Emily so she can launch her presentation and share it with you. Emily, you'll just need to unmute yourself.
Is that working now?
Yes,
okay.
That's great.
Mute me automatically. Okay, so thanks very much to Rada for giving this opportunity to present on the integration resource guide. So myself and Aaron will be presenting. Aaron, maybe you can just introduce yourself just before your presentation. I work in WHO headquarters here in Geneva, Switzerland, with a focus on integration and life course vaccination. So I wanted to first of all start off by thanking you all for joining and for the incredible interest that we've seen in the topic of integration. I've been really happy to see that there's been a lot of interest in this particular topic through the webinar, through the Scholar program, and also really impressive just to see all the number of different countries that the participants are joining from. So I'm hoping that you'll find something of relevance to your own context within the presentation that I'm going to share today. So what are we going to talk about today? So there's 3 main topics. The first one is I'm going to talk through what we can learn from the Working Together guide. And there's 2 areas to look at. One is vaccination throughout the life course, and the other one is around integration and immunization programs. Then Aaron will take over and he's going to talk about what do we know about integration and immunization programs. This is based on literature reviews. There's also some lessons from implementation, and also talking a little bit about the potential benefits and the risks. And then finally, the last part of the webinar, I'm going to present some considerations for planning an integration project, some more practical tips, and also some additional references to help you as you continue working on this topic. So as we just discussed, the Working Together guide is the main resource guide. It's called an integration resource guide for immunization services throughout the life course. It is currently available in English and in French on the WHO website. The contents of the guide, I'm not going to go over in great detail, but I did want to just highlight a couple of things here. One is that the guide is quite long. It's around 150 pages. The idea really is not so much around reading it from scratch from page 1 to 150 non-stop, but really about being able to pick and choose the parts that are relevant for you. After the introduction, we talk about the types of introduction, the health services that could provide immunization services, a big chapter, chapter 4 on planning for integrated immunization programs, chapter 5 on the benefits and risks of integrated immunization programs, followed by a chapter on monitoring and evaluation, a chapter on useful references. A very important thing to keep in mind is not to forget the appendix. Unlike some guides, the appendix here really includes some of the key information, particularly on integrated service delivery. So you see here on slide 6, in the box, we see the different topics that are included here. These are all different services that could be provided alongside immunization. The appendix already has gathered together for you a number of resources. It talks about the WHO recommendation, the opportunities to link with immunization, and that could be that there's similar contact points, the summary of documented experiences, and considerations for integration. This could be more of a practical consideration of things that might be needed, and also the useful references, the references that are specific to that service type. So now I'm going to move on to talk about vaccination along the life course. So first of all, why is this something that's important? So I think some of you may have seen this slide yesterday in Samir's presentation, but I wanted to re-include it again just to reinforce the message that we've seen a lot of innovation in vaccines and in immunization programs in the past few years. In 1974, the EPI program only had 6 antigens: BCG, OPV, DTP, and measles. And now we really have a lot more vaccines. And when you look on the next slide, which is our summary of the WHO recommendations for routine immunization, you see that we now have 12 antigens that are recommended for everyone in all countries, plus another selection of vaccines that are recommended for certain regions, some high-risk populations, and other immunization programs with certain characteristics. The other thing you'll note on these 2 tables is along the top that you see that the recommendations cross children, adolescents, and adults. And so we're starting to see this life course approach. Now, why is that important? I think the key thing is that these new vaccines, we do need to deliver them throughout the life course. We're no longer just focused on infant vaccination. And so WHO has been giving a lot of thought around how we can improve the delivery of these vaccines. And one of the concepts that I wanted to talk about today was the concept of delivery platforms. And in the green section on the slide here, you can see that some examples of delivery platforms that we are proposing. So it could be a platform for pregnant women, for newborns, infants, obviously would be the standard EPI program, second year of life, you heard about that yesterday, older child, adolescent, adult, older people. And that these groupings can be used to deliver vaccines, but not just vaccines, also other interventions. And that's where the integration part comes in. Of note is that countries should determine their own groupings for this based on their needs and their context. For example, some countries might have school health programs or other interventions to be delivered at certain ages. So moving on to slide 12, this is really a key figure from the Working Together guide. And this combines the elements of the life course approach along the top And then vertically, you see the different type of interventions that could be provided alongside immunization in each of the delivery platforms. So for example, if you look at pregnant women, you could see there might be nutritional counseling, vitamin A supplementation, the distribution of bed nets, etc. So this is really a key resource and a key starting point. But again, this can be adjusted based on the country's own context. So on that note, I'm now going to transition to talking more about integration within immunization programs. And actually, we're going to start with another poll question. Radar, should I hand back over to you?
No need. We can launch the poll from here. Okay. So you can see the two questions here, and I'm now going to launch this second poll about your experience with integration. So you will see up on your screen once again a question, and then you click to the next question if you're on a mobile device, a phone or a tablet. So the first question is, have you had experience on working on health issues beyond immunization? And if yes, tell us which health areas you've had experience with. And you can select more than one on the second poll. All right, and I see this is obviously a very sharp group. We've already got over 50 people who have completed the poll, and we can see the results coming in, and then we'll share them with you. This might be also, once you've finished the poll, you might want to have a look at the Q&A. So submit your responses first, your answers first, and then check out the Q&A. If you're still finding your way around and you're not sure how to find the poll or the Q&A or the chat, that's okay. Take your time and don't panic, and take your time to answer the poll, and then maybe if there's still time, look for the Q&A if you have a question. Remember that you can also vote on questions, and so we have, all right, some very clear answers or patterns emerging in your answers. We've got almost 400 people who have already voted. This is an amazing number of people, participants connected from all over the world. And I hope you're getting a sense of that when you see or that you will when you get the poll results as well as in the chat. All right, let's end the poll now. And we've got over 400 people who have voted, and now we'll share the results with you, and we'll ask Emily and perhaps Aaron to comment on these results.
Thanks, Rada. Yes, it's really interesting. We see that 98% of the participants have had experience on working on health issues beyond immunization. And for me, that's a really exciting result. And I hope the people that have this type of experience can really start combining the experience they have in immunization with the experience they have working on other health issues, and trying to find areas for collaboration and coordination. And then the second part of the question, looking at the types of experience, which areas, the majority seems to be in maternal and child health, which I guess is to be expected given the links with immunization. But we also have quite a number that have 40% in adolescent health, 56% in malaria, almost half in HIV. Yeah, a lot is still in neglected tropical diseases, 35%, 49% family planning, 36% in WASH, and 26% in others. So I'm really impressed actually with the experience of the participants already, far beyond immunization. I don't know, Aaron, do you have any other comments?
Yeah, I mean, I would agree. This shows a wide range of experiences that the participants have, and this is often what we're seeing out in the field, is that your job is not just about immunization or not just about a single health topic, but really is a wide range of different health and even non-health topics being covered. So this is great to see.
All right. Okay, thank you both, and thank you participants for being so active in responding to the poll. And back to you, Emily, for the next part of your presentation.
Great, thanks very much. So moving on, we're going to continue discussing on integration in a little bit more depth. So first of all, and the question I'm most often asked when I tell people that I work on integration is, what is integration? And everyone would like a very simple definition, but at this point, we haven't yet got one. There's a real range of definitions, and I think that's because there's a real range of different types of integration that exist within immunization services. I'll talk a little bit more about that as we go through the presentation. But in terms of one type of integration, which is integrated health services, WHO's definition, which comes from this document there that you can see from 2008, is about the management and delivery of health services so that clients receive a continuum of preventive and curative services according to their needs over time and across different levels of the health system. And I think that pulls together many of the aspects of integrated health systems, but I'd say that we could still even go broader, and we'll see when we get to the slide around the rationale for integration as well. So what do we say about integration really in some of the global policies and strategies? Well, first of all, we've got integration as a key part of the Global Vaccine Action Plan, sometimes referred to as GVAP. That's the Global Vaccine Action Plan, runs from 2011 to 2020. And you'll see here at the bottom that integration is one of the 6 principles underpinning the GVAP. And under integration, it says strong immunization systems as part of broader health systems and closely coordinated with other primary healthcare delivery programs are essential for achieving immunization goals. And furthermore, in the text of the GVAP, there are 2 quotes that I wanted to share with you as well. So the first being that immunization service delivery should continue to serve as a platform for providing other priority public health interventions. And this I think we are already doing, but we could be doing more of. The second part is other priority programs should also serve as a platform for delivering immunization. Every contact with the health sector should be used as an opportunity to verify immunization status and provide immunization where indicated. And this area of work is actually related to the missed opportunities for vaccination, of which there will be a later webinar on, and I would strongly encourage you all to attend, because the integration and the missed opportunities of vaccination, second year life, all these things are interrelated really. Integration and the Sustainable Development Goals. So here I've actually got a quote from Dr. Margaret Chan, who is the ex-Director General of WHO. I thought it was quite an interesting quote because it summarizes some of the opportunities and the challenges of integration. So she says, by taking a more integrated approach to development, the SDGs present us with an opportunity to advance, seizing opportunities to collaborate and exploit synergies. However, there are clearly challenges too. For example, in order to take on cross-cutting issues, it will be necessary to achieve far greater intersectoral coherence and coordination of effort. And so I think this is true. You know, she's talking a lot that there's a lot of opportunities around integration, but also some challenges to overcome and some practical considerations of how to go about working with other sectors, how to coordinate activities, and to really maximize the synergies between them. So moving on, looking at it from a slightly different lens, you know, why is there this interest in integration with immunization programs in particular? And one of the reasons really for this interest is that immunization is one of the interventions that's managed to achieve very high coverage rates around the world in many countries. Some countries are still lagging behind, but many countries it's often an intervention that has the highest coverage of all the interventions. This slide shows coverage rates for different interventions along the life course. So starting on the left-hand side, pre-pregnancy, looking at family planning, then into pregnancy, birth, postnatal, infancy, childhood, and then a sort of a mixed age. What we see is that the ones highlighted in red, in the red box, are the immunization ones, and you'll see that they're relatively higher compared to the other interventions. And that's raised the interest in integration within immunization, because we're bringing a platform to deliver these interventions that's already proven to work. Importantly, though, I think we also have to look at what integration can bring to the vaccination program. And I think a critical link here is that it can reduce the missed opportunities for vaccination. There's a lot of data on this slide, so don't worry too much. The important part really is that if you look at the chart on the right, you'll see that many of the children in this study in Malawi were actually missed when they were coming for medical consultation. Either the health worker didn't ask for their vaccination status, or the vaccine area was closed, or no one thought about it because it wasn't the primary purpose of the visit. But we're missing a lot of people that are coming to the health center that need to be vaccinated, that we're missing that opportunity to do so. And actually integration and improving the coordination between the different programs, we could help to reduce the missed opportunities and therefore increase the coverage. So moving on to the rationale for integration, which is on slide 20 for those of you following separately. I think one of the advantages of the immunization program is also that we have a schedule. We have multiple contact points, and a lot of the interventions we might want to deliver have similar target populations. So for example, vitamin A supplementation or deworming. I've already talked about the high immunization coverage rates, but I think it's also important here to flag that, you know, you can have services which are designed either for the child coming for immunization, but also for the caregiver. And we've seen some examples in the literature of integration with family planning or HIV testing, but targeted at the caregiver rather than the child. It's also a moment to think a little bit differently. I've talked already about how integration of immunization into other services could reduce MOVs, missed opportunities for vaccination, but it could also facilitate delivery through the life course. So for example, if we think about how we're going to reach pregnant women with vaccines, doing that through antenatal care makes sense. Or similarly, doing that HPV through school health for adolescents, similarly. The fourth bullet on here, the integration of immunization with other services. This also supports what we call comprehensive approaches for disease control. An example of that is comprehensive cervical cancer control. So where a country may introduce the HPV vaccine, but that might not be enough. You know, you also need to have screening and treatment for cervical cancer as well as the vaccination. And then lastly, the integration and the interest and the rationale comes from this growing need for multi-sectoral approaches. By what we mean, you're interacting with other sectors beyond health. So for example, cholera vaccination together with WASH interventions, or school-based delivery of immunization. So the need to work together with the education sector. There's on slide 21 an example around HPV and adolescent health. I won't go into this in too much detail because we're limited on time, but I have included the reference here. And this is the key figure from that presentation, from that document, which shows you the different types of interventions that you could consider including alongside HPV vaccine to the adolescents that are being targeted. The next example, slide 22, is an example from Lao where we see that integration can also have benefits in a campaign setting as well as routine immunization. In this case, it's one of the few examples we found in the literature where they had costed the integrated campaign, so immunization plus adding deworming, and then costing the deworming campaign separately. And what we see here is that the cost of the campaign would fall from 23 cents to just 0.03 cents per treated person when the deworming was added to an existing campaign. And in particular, you saw savings around personnel costs, supervision visits, that kind of thing, training. So it made sort of an efficient use of the existing resources. Okay, at this point, I'm going to hand over to Aaron, and then he'll talk us through this section, which is what do we know about integration in immunization programs? Okay, over to you, Aaron.
Great. So Emily,
yeah, go ahead.
Yes, Emily and Aaron, we have quite a few questions actually that seem to be recurring about concerns about Diallo Mamadou Mustafa, who says, could integration lead to low quality of services? Aminata Nunye, who's asked, does it not compromise the quality of interventions provided? Asad Ali, what about the cost and feasibility of integration? And Aminata, who says, we know integration is cost effective, but does it not also limit the attention needed by some specific interventions? That seems to be a recurring question. Would you like to address that now, or would you like to do that in your presentation or towards the end of the talk?
Well, I think I could just say very briefly that I think all those questions that the participants are exactly right, that we have to take a very balanced view about integration. And I think from a WHO perspective, we're very much in favor of it, but only where it makes sense. And it has to make sense in the local context. Based on the resources that are available, based on how if there's additional time available for health workers. Some of these benefits and risks we're actually going to talk about now in the coming slides. So I don't know, maybe Aaron could make a brief remark also, and then I'd suggest we continue with the presentation and then see at the end if there are additional comments or reflections based on that.
Yeah, thanks, Great. Emily. I will touch base on this particular topic area, I think, in the next few slides. So I'll try to make sure I respond to that as I go through these points, because they are directly addressing that key question. Does that sound good? So before I jump in, just a quick introduction for myself. My name is Aaron Wallace, and I'm with CDC Atlanta in the Global Immunization Division. I've been here for about 15 years, and integration with immunizations has been one of my specialized areas for the past several years. So I'm going to jump into this and talk a little bit about the current evidence we have around integrated service delivery within the immunization context. At CDC, we conducted 2 systematic reviews that looked at the literature that had been published and also unpublished literature around looking at the benefits and risks of integration in the context of immunization. And we also sponsored a journal supplement where we're able to get several agencies, countries, ministries of health to put together papers around their integration experiences. And that was published in 2012. And then we also have been supporting a newer integration lit review looking at literature for the past 10 years or so. So I'm going to walk through some of that evidence in the next few slides around the experiences and benefits and risks of integration. So go to the next slide. Thank you. So just a big picture, our integrated integration lit reviews focus very much at integration at the service delivery level. So essentially combining that immunization visits with other interventions. And we saw generally 3 different types of delivery models. We saw a delivery model where a health worker is providing the routine vaccination visit, and alongside that, they're also providing another health intervention or potentially more than one health intervention on that same exact visit. Another delivery model that we saw was where the child comes in or the beneficiary comes in for a routine vaccination visit, and either the beneficiary or the parent or caregiver is referred for a follow-up visit for another health intervention, either at the same day or to another health facility in the future. And then the last delivery model was the combination of the traditional vaccination campaigns with other health interventions. And this also included child health weeks, or what we're often seeing periodic intensification of routine immunization, or PURI activities, where not just vaccinations are being provided, but also several other health interventions are being provided during this time-limited activity. Next slide. So this table in front of you just really provides a summary of what we saw in the documented literature, documented experiences out there for the past 20 plus years in terms of the types of interventions that have been linked with the immunization platform. And it's quite a wide variety, everything from family planning to malaria prevention services like bed nets, distribution, use of intermittent preventative treatment of infants, or IPTI, nutritional approaches such as vitamin A supplementation. There are examples around use of the routine vaccination visit for providing HIV testing and counseling, both to the infant and to the caregiver. And then a couple of somewhat less traditional health services also being integrated into that routine vaccination visit, which included hearing screening, safe water interventions, and then also health education was being linked in more of a group setting alongside that vaccination visit. And you'll see these different types of interventions were being linked both within that campaign setting for vaccinations as well as for routine delivery of vaccinations. So going to the next slide, thanks. There's several different lessons that have been documented in these experiences for implementing an integrated service delivery model, whether it's a campaign approach or a routine delivery approach. And what the authors often were seeing in these integrated approaches were there were many different types of challenges that weren't necessarily specific to the concept of integration. That when one is embarking upon trying to do an integrated approach, there really is a need to have at baseline a fairly well-functioning health system. So if you're going to build on that immunization platform, that generally there's greater success that's going to be attained in linking another health intervention if one's immunization system is at a fairly high coverage level. And this kind of goes into the next point where what was seen in a few different experiences were linking a fairly weak vaccination program, like pretty low coverage, to another intervention that was just starting up, did not end up resulting in having a strong integrated system. That really what they were discovering was there was a need to build up the resources, the basic resources for delivery of one intervention before really considering moving on to linkages with additional health interventions. And this kind of goes to the points that have been made in some of the Q&A right now around the needs for ensuring sufficient resources for being able to add another health intervention or additional health interventions onto an existing platform. So that's where there's been this concern of potentially overloading the system if one does not bring on board additional health workers and really account for the fact that one can stress a relatively well-performing system if one does not provide sufficient resources when doing this integration approach. And this concept really goes to this idea that integration is not going to simply solve your low coverage challenges that you may have with other health interventions. Even if your vaccination program is performing well, linking together doesn't necessarily mean that now suddenly all the health interventions are achieving 80 or 90% coverage. That there's really a need for extensive planning and mapping out the resources and getting all the different groups within the Ministry of Health and Ministry of Finance and so forth to buy into this idea that this integration approach has other benefits, but we also need to make sure that we are planning well to make sure that this is a successful rollout. As Emily was saying earlier, integration can be very context and country specific. That there can be this recommended package of health interventions that every child and caregiver should be receiving. However, there really needs to be an understanding about what are the resources available on the ground, and that there may have to be a phased approach where one is slowly rolling up towards a well-integrated health package for the entire population in a country, but that this may be something that really has to be done over a several-year period. And there also has to be an understanding that from country to country, there's different perceptions about how different health interventions are perceived. So for instance, one experience that we had at CDC and others have had is around linking HIV or PMTCT services to routine vaccination visits. And the experience we documented there was a lot of concern within these communities around linking these HIV services to the routine vaccination visits, and whether they were going to be stigmatized by receiving HIV services through the routine vaccination visits. And so there was concern about potential drop-off in coverage for the routine vaccination visits. Lastly, there's this concern around with supplemental activities that one really needs to be able to ensure that they understand that supplemental activities are a time-limited activity, and so they're very intensive, and one needs to really consider what are appropriate interventions that should be linked into such a setting. And let's say, for instance, a relatively simple intervention, say like distribution of deworming tablets, could be a good linkage with a measles campaign, but the provision of family planning services, which can require quite a bit of education and behavioral change communications. So essentially a long visit with a beneficiary may not be the best type of activity to link into a time-limited measles campaign. So going on to the next slide. So we'll jump a little bit into just talking through some of the potential benefits and risks of integration. And Emily talked a bit when talking a bit about the rationale for integration. This really ties a lot into the potential benefits of integration. And hence the rationale for why, at least very early on, there was this push for integration, like trying to understand like what were going to be the best approaches to doing integrated service delivery within the immunization platform. And so some of the key benefits here are this idea that generally vaccination programs, whether it's routine or campaign approaches, have had fairly good success in reaching their target populations, 80+% coverage, and many other health interventions targeting the same populations have struggled to achieve those same levels. So the linkage there, essentially going into that same platform as immunizations, one could more or less bring up that coverage of that linked intervention. Another one is around the economics of integration. So in theory, by linking these two or more interventions together, one can achieve efficiencies around the delivery of these two interventions by essentially having the same health worker provide these. One is reducing costs on both the health sector side as well as on the household side, essentially through reduced household visits to the health facility to receive health interventions in that same visit. And potentially that can also lead to higher user satisfaction if one is providing all of the health services that a beneficiary wants to have in a single visit, then in theory you achieve higher user satisfaction by providing those services to them. There's also the potential benefit around improving demand, both for vaccinations as well as for other health interventions. And this can be done through just making the beneficiary aware that there's these other health services that are available to themselves and to their children. And this can result in missed opportunities, both for vaccination as well as for the other health interventions. But we do see many potential risks that could occur as well. One that's been cited quite a bit is around potential negative impact on equity. So in many places, coverage for vaccinations is getting up to 80, 90%, but we're still missing that last 10 or 20%. And if you do the integrated approach, you're still going to reach that 80 or 90%, but you may still be missing that last 10% for your integrated approach as well. So you're actually likely pushing that inequity even further by not reaching that last 10 to 15% with even your integrated health package. There's that concern that was raised in the Q&A as well around if there's not enough resources made available in the integrated approach to hire more health workers, then you potentially have an impact on reduced quality of care because the health worker now is providing, say, 5 or 6 interventions, whereas before they were providing 1 or 2 health interventions, and they're still having to do this within the same 8-hour workday that they're given. And so now they have less time for each beneficiary. And so that health worker may really struggle with wanting to take on these additional responsibilities. So what's been cited a lot in the literature is that that increased workload that can result in the health worker being less satisfied around their job, and potentially now you're impacting the human resource for health there. And then lastly, beneficiaries may not be responsive to the Ministry of Health linking different health interventions together, especially if certain health interventions have some level of stigma around them. And what we've seen often in the literature is has been cited around both family planning and HIV services when it comes to trying to link to the routine vaccination visits or even the campaign approaches. So I think.
All right, Aaron, just a point of order. We've got 14 minutes left, and I know there are quite a few slides and content that you'd like to cover. So please keep that in mind. And I know that Emily might at least, and I hope you as well, would be able to stay for a few minutes over. We have 71 questions pending, so if I could ask if we could keep on time, and also if I could ask you, if at all possible, to stay a few minutes over, that would be much appreciated by us and by the participants.
Yeah, thanks, Rita. Yes, I'm happy to stay a little bit longer after the end of the webinar. So I will move on fairly swiftly, and there's a few points actually have already been covered now, so I think we can make up some time. So I'm going to talk a bit about the planning for integrated service delivery. So this is one of the sections from the Working Together guide. I'm not going to go through it in detail, but I wanted participants to know it was here. These are the key considerations before integrating immunization with other interventions, and they fall under 2 categories. One, is it related to the intervention, and the other is related to the health system context. Because obviously we've got all of the immunization programs are within the health system context. So if there's not enough health workers, for example, then you have a context where it would be difficult to add and combine more things. But particularly related to the intervention, you could look at things like, is the target group the same? Does it require similar timing or frequency, similar to routine immunization? Does it have similar logistical requirements, or is it easy to add those in? Also around the level of acceptability for patients, communities, and health workers. And is it the right skill set for the health workers that will be delivering? 2 other really critical components I think about integration projects. One is, do you have the resources you need? And that could be a number of areas. But I think one that's particularly interesting is this example on health worker time, which is funny that I'm presenting because Aaron actually was involved in the work to do this. But what they looked at was actually timing the different interventions that were given. And what's of note really is when you see the infant vaccination median time, 2 minutes 22, which was actually relatively low compared to some of the other interventions that you could see are that require more time with the health worker. And so what this shows is you've got to be very careful around the interventions that you choose to integrate, and think carefully about what that might mean in terms of waiting time for the patients, or in terms of health worker acceptability, for example. The other critical question, and Aaron mentioned it, I do want to re-emphasize it, it's really the importance of whether the change that you're proposing is going to be acceptable to not just the patients, but the caregivers as well, but also the health workers. And here are some, I think, quite interesting quotes. One way to find out is to go and ask people what they think, both before the service is integrated, but also once the service has changed or something is different, to go and ask people and understand what they think about it and how it could potentially be further improved. Just read on the mother in Kenya quote, the one on the top right. It has motivated us, even those who never came before, because if we go and say we've been given soap and water guard, they come to the facility, i.e. the other people come to the facility. Similarly, the one at the bottom, the health worker in Mali, the advantages that mothers like ITN is insecticide treated net. Before, if you ask the mother to come back at 9 months, there are some who do not return, but at 9 months, the women know very well, we give them an ITN, they do not miss this opportunity. So I think just highlighting some of the feedback that you can receive from patients and health workers. A really critical resource actually that's included within the Working Together guide is this, what we call the Integrated Service Checklist. It's on page 71 of the English guide. And it really goes through in detail. It provides a structure for people to use to go through and answer various questions to understand whether the proposed integration project makes sense. And it looks at, as well as general benefits and risks and support, it looks at, does it make sense in the context that would be delivering the project in? Are the two services or more services, are they compatible? Is there an overlap between the target population? Is the timing compatible? And looking at the coverage level also before the services are integrated. Feasibility, does are all of the interventions, do they have funding available? How many things could be delivered in one go? Looking at the earlier example on time. Acceptability, we've discussed already. Equity, Aaron mentioned this as well. You've got to think very carefully. If you provide more interventions at the same time, are you going to create issues around equity of access? And lastly, and very importantly, is accountability. And this would include some of the monitoring and evaluation strategies. But you have to decide on where does the accountability fall for delivering these interventions. There's a lot more I could say about the checklist, but I'm going to leave it there. It's also included in the Dropbox link the Radar shared at the beginning of the webinar. So go back into the chat to find the link to it as well, or in the Working Together guide. Just a few tips now on developing your project, and then I'll end with some additional references. So here I've just really highlighted which are the key parts of the guide that you should be reading to start thinking about your project. Really, everyone should read the executive summary and about this guide. And then chapters 1, 2, and 3 provide more content, more depth to some of the information we've been presenting today around the types of integration, different types of health services. Also, throughout the guide, you'll find a whole series of different case studies in boxes based on different countries' experiences in really vastly differing aspects of integration, and that would definitely be worth flicking through and having a read of some of those. I think it's important to say that we would love these projects that people develop now really to be implemented in the future. And I think one of the key things that will help that future implementation is to really focus on your own context and what you know, both in terms of your own country, understanding the national schedule, what other interventions are already being delivered, any cultural issues, sensitivities, stigma around certain services, any rural-urban differences as well. And then I think when you start thinking through to the specifics of your project, it would be worth choosing either an integrated service delivery, so particularly looking at routine immunization, and then you might want to take one delivery platform to focus on and think about adding other interventions. A second option would be to look at any campaigns that are coming up and think about how some other things could be integrated into a campaign. Or thirdly, integrated health systems. For me personally, I think this option is a little bit more complicated, so I would advise people to stick to one of the first two if something comes up that works for them. But you could also look at things to do with the health system, so integrated supportive supervision or supply chains. And then I'd choose the appropriate level of the health system for you, where you've got information and experience. Then lastly, there's more planning parts of the guide that would be useful to start thinking through your specific project. So that would be chapter 5 to look at the benefits and the risks, chapter 4 to help you plan, chapter 6 to develop a monitoring and evaluation plan, And as I mentioned at the beginning, really important to use the appendix of the Working Together guide, because that gives you the extra information about the specific services that could be integrated with immunization. And I've again just referenced here the integrated service checklist, which would really help as you start thinking through the details of your projects. So the key references, obviously you've got the link to the guide, it's also in the Dropbox. But then even within the guide, there are more references under each of the chapters in the appendix. So if you look, this example is from the malaria chapter. These are like topic specific references. And obviously, because you're going to be so keen, I've given even more references on this last page here, which is really a range of different types of references, from WHO guidance to academic work, including Aaron's work that he led and published in 2012. And then some information around some of the comprehensive approaches. So I'm going to stop there, but I'll just remind you about the 2 upcoming webinars on urban immunization, 27th of May, and missed opportunities for vaccination on the 29th of May. And lastly, just to say thank you. And over to you, Rada.
Thank you so much, Emily and Aaron, for this presentation. We have had 55 questions already answered. Yes, we still have 85 questions open, and some of the participants are sharing. It's obvious that they have experience as well with the topic. So there is actually only one question so far that has garnered more than 20 votes. But I really appreciate the fact that you've accepted. You're able to stay on for a few more minutes, so we can tackle some of these questions, and perhaps invite some of the participants to speak and explain why this question is of concern to them. So I'd like to start with Steve Mwangi, whose question has in fact received 26 upvotes. And his question is the following: what happens to EPI when integrated supportive supervision focuses on other well-funded programs like HIV/AIDS, nutrition, etc., and ultimately immunization becomes any other business as supervisors close their supervision visit? How can we ensure a balanced, integrated approach during supervision and other activities? Now, before we get you to answer that, we're going to at least try to connect Steve Mwangi so that we can hear Steve Mwangi. I'm going to unmute you, and I see you're connected by phone. So hopefully you'll be able to speak to us and explain to us what first introduce yourself, tell us where you're connecting from, what is your work, and then explain this question for us so we can properly understand it and help Emily and Aaron answer it.
Hello, you can hear me?
Yes, loud and clear. Steve Mwangi.
Yeah, I'm Steve Mwangi, connecting from Addis Ababa, WHO country office. My question, just like it has been read out, is the issue of integration of immunization services, because we know sometimes we lose out on the benefit, and especially where immunization is treated as that last part. And therefore, my question was, what are the cost-benefit analysis, or even maybe, is it possible to ensure that we have a balanced kind of integration so that we do not lose out any important part? I work for WHO under immunization and surveillance. Thank you.
Great. So Emily and Aaron, over to you.
Thanks, and a great question. I think that for me, I guess you're maybe coming at this from someone who's had experience in working in this area. I think to address these types of challenges, really the programs have to be working together at all levels of the health system. And so not just at the end, so that for me, the programs that are involved in integrated supervision and supportive supervision need to work together to plan and agree and normally develop a checklist with the different sections and making sure that it's balanced. Maybe some practicalities around not having, for example, all the other topics and then put immunization at the end, knowing that if the time runs out, that will get skipped. But maybe starting with some of the key questions and then moving on. yeah, that would be my comment here. But I think also to say that, you know, as we said, integration doesn't always make sense in all contexts, in all cases, and so maybe there's you know, good reasons why HIV and AIDS and nutrition might be integrated, but not immunization, because maybe immunization happens during a different moment or during a different person with a different skill set who comes. So I think it has to also be very context specific. Aaron, do you have anything else to add on that one?
Yeah, I mean, just to add a few things. I mean, I think this is a really important aspect of integration that does come up quite a bit that we've seen. And I think there's approaches on both sides in the sense of, like Emily was saying, the development of an integrated supervision checklist would ideally involve all of the different key stakeholders across the different health interventions to come to an integrated checklist that is sufficiently being applied across all the different health interventions, but it will require compromise on across all the different stakeholders grouped, including on immunization. And we have seen this a lot, where we have a lot of more standalone immunization specific tools that now there's a push for the integration. And in the past, integration maybe having asked, you know, 30, 40 questions, or is monitoring 10 to 20 different things on a routine monthly basis. And now the integrated approach only allows for immunization to monitor, say, 5 or 6 things. There's a compromise that I guess has to be done, at least when you have this constraint around resources. And I mean, one of the approaches I've seen on the ground in terms of the integrated supervision is where resources are feasible. You have supervisors that are coming from different organizations, or you have some type of capacity building across the supervisors, across the different health interventions that get trained on how to supervise across multiple health interventions. Maybe you're coming as the HIV supervisor, but you get trained up as also the immunization supervisor as well. So you actually have this opportunity to build capacity across health interventions for the supervisor level.
Thank you, Emily and Aaron. Let's go back to Steve Mwangi to see if he is satisfied with the with your responses. Steve Mwangi, are you able to unmute yourself? Yes.
Yeah, thank you. That was a good reply. Maybe just to say that it is very true that we can work with integration, but more importantly is where we have seen different programs having different resource package. And therefore, when we talk about integration, we're also talking about the resource envelope. And therefore, you'll find that different programs may have different types and amounts of resources. And therefore, sometimes it has not always gone well, because one program, nutrition, may not be having something, and maybe surveillance has something, immunization has something. How can we work together to ensure that there's a balance, and so that each component is important? Thank you.
Okay, thank you very much. Let's go now to, so we have another question that has actually garnered 40 upvotes. And so it was originally asked by Nibiu Sise, who says, I think integrating services has many advantages and disadvantages. How do you see this in areas where there's a shortage of human resources to integrate EPI with other services? And this has led actually to quite a lively exchange with other participants about what this involves. Leonard Ewan commented, in a system where there's a lack of qualified human resources, integrating immunization with other services becomes imperative, in fact. So it'd be good to first hear from Nibiu to hear, more from this participant. I'm trying to unmute you, Nibiu, so you'll need to unmute yourself in order for it to work. And then we spotted another question that's kind of representative of questions asked by many participants. And so we've queued up Dr. Sida Lingaya, who will be next. So Nibiu Sise, are you able to unmute yourself? You've now been given the ability to speak to us. But if not, Emily and Aaron, you can see this is the question that has received the greatest number of upvotes from other participants. Would love to hear from you about it.
Hello.
We'll come back to you, Dr. Sida Lingaya, in a couple of minutes. Let's first hear from Emily and Aaron about Nebiu Sisi's question.
Thanks, Reda. Yeah, no, it's interesting to see also the responses coming back also regarding this issue. I mean, I guess my initial reaction was yes to say that you know, where there are shortages of human resources, you know, I think integration could be seen as either an opportunity or a challenge. You know, you have an opportunity maybe to make more efficient use of the resources that are there and available. And then on the other side, obviously the challenge aspect, you know, integrated services, it can be more efficient, but also takes more time to deliver or could increase waiting times for patients, for example, who now, you know, each person takes longer, so therefore the waiting time increases, and that could have a reduction in acceptability. And then on the opportunity side, yes, you know, I think many countries around the world are struggling with this this issue of you know, reduction in human resources, and I think there's no easy answers to it. And I think yes, we have to think about whether integration is going to make sense in that context or not. But I think from my understanding, from my discussions with colleagues from country visits, you see that often at the lower levels of the health system, there's natural integration because there may only be 1 or 2 health workers at that facility, and therefore they're providing a range of services, possibly structured in different ways depending on the context, but often more integrated further down. We're also keen to start seeing more integration, more interaction, more discussion, you know, at the national level, the regional level, to really maximize the synergies that are there between the different programs. But no, I think that there's definitely some good comments here, and it's definitely not an easy question to answer. Aaron, anything from your work that you've seen?
Yeah, I would agree. This is not an easy question to answer. In fact, what we've seen in integration research is a shift from the original question of, is integration, does it make sense, to now, how do we do integration? We know that it's happening, and as Emily, you said, when you get down to the service delivery level, it's often just 1 or 2 people. And so it really is an integrated health workers providing all these health services. And I see, like what's mentioned, this concept of task shifting. So essentially at the policy level, what are things that could be done by the ministry to help provide a environment that is conducive to allowing integration to work within that limited resource? And so on the research side, we've seen research around what's known as patient flow. So the idea of how do you keep people moving most efficiently through a health facility when you have high numbers of beneficiaries coming in. And this is also true with integration, where you have a high number of health interventions that you want to deliver. And so that's where a lot of the research has been more focused on. So these are things that are out there as potential resources.
Thank you both. I hope Nebiu Sise that and as well as Leonard Iwane, Lucy Kanja, and Melaku Ejiku, who contributed to this question, are satisfied with the answer. I'm now going to turn to Dr. Sida Lingaya, whose question did not necessarily get a great number of votes, but whose question echoes many other questions, many other similar questions. So Dr. Sida Lingaya, are you able to speak to us?
Yes, thank you. Thank you very much for the opportunity.
All right, welcome. So your question was, isn't it true that integrated service delivery attempts were replaced by focused vertical program models due to to the ineffectiveness and inefficiency of the latter? And this has been asked in different ways by many participants. So Dr. Sidalingaya, would you like to introduce yourself and explain to us why this was an important question for you, and what is the context and your history with respect to that question and these challenges?
Yeah, thank you for the opportunity. Actually, I'm working as surveillance medical officer at the district level, with looking after a few districts in Karnataka, India. So I just wanted to know, like we have so many programs like tuberculosis program, malaria program, vector-borne disease control programs. Every time, like lot of time and energy will be spent on each of these programs, and even both from the provider side as well as the recipient side, like multiple efforts will be put on these programs, even maybe like albendazole deworming programs. Integration is fine, but like if they try to do everything, all these programs at the same time, especially at the the frontline health worker level, quality issues actually do occur, and even the supervision issues and focus, and we have seen it in the past, and and that is how even now there is a more focus on sort of each program is taken up as a separate entity, and like even from state level and national level, they send guidelines for draining, separate draining, and that's happening. So sort of if you ask my experience, it is my just observation.
Okay, thank you, Doctor.
So
all right.
Yeah.
Let's now hear from Emily and Aaron, and we've already addressed some aspects of this, but it's been such a recurring theme, and I imagine both of you are well aware of this set of issues. We'd love to hear your response to Dr. Sidalingaya.
Thank you very much for the question, and I think yes, it's true that it's always a very interesting topic with a lot of debate around the virtues of going for these vertical approaches rather than more of a sort of a health system strengthening approach. My answer would be that with this guideline, the Working Together resource guide, the work that we're doing now within the immunization program at WHO, the idea behind it isn't so much that we're trying to say we need to integrate everything at all times, we need to integrate the maximum that we can. But I think it's really a recognition that that we, on one side, we have a very strong program and we could be doing more to strengthen primary healthcare. And then on the other side, we've seen some work through missed opportunities for vaccination, where we're seeing that we're missing people that do have access to a health facility, that are attending the health facility for other reasons, that are not being vaccinated for sometimes relatively straightforward reasons, or there's no screening or referral, for example. So these are things that could be changed, that we could see an increase in the performance of the immunization program through some simple integration efforts. I think we need to think very carefully about what the synergies are and not attempt to do everything all at once. The other thing I would say is that I think, at least at the global level now, I'm seeing more and more recognition from Gavi, from others, WHO especially, that we're realizing that as we move to a life course approach, particularly for immunization, so we're going beyond reaching the infants, that we really need to work in a different way, and that actually integration with other programs is going to become more and more important. To reach pregnant women, we're already doing that through antenatal care with tetanus vaccination. We'll need to do it more as we get new vaccines for maternal immunization. Similarly, maybe to make some increases on, some movement on the birth doses, we need to integrate with postnatal care. So I think it's two ways. One, on one side, I think we can see immunization could contribute in a more integrated way towards primary healthcare, but also that thinking differently could have positive implications for immunization. but we need to be strategic in the way that we do it. And it's, you know, not necessarily a blanket approach, and it's not because we have this guide that our position is really that all countries, all contexts need to be everything as much as possible. That's not the case. But I agree with you, there's been this shift, and I think now again we're seeing a shift back towards primary healthcare, and we saw the recent Astana declaration on primary healthcare, for example. So there are moves in that direction. Over to you, Aaron.
Thanks, Emily. I think you hit on all the key points, and I do agree with you as well. Like, there's definitely this original approach of primary healthcare that went to more of a vertical approach, I think, with a realization that in the focus countries, there wasn't enough resources to really jump straight into primary healthcare. So let's start with a selective package and try to roll up coverage and then establish that as an initial foundation. I think we're finally able to revisit this again in many countries that have established this foundation. And really, as Emily was saying, on the vaccination side, we are now seeing so many vaccines where not just the vaccine is needed. There is so many other health interventions that need to go alongside in these packages. And I think from a global standpoint, I think there's an imperative for a well-funded global program like global immunizations to be able to step up and say, what can we really contribute more broadly to primary health care? Over to the group.
All right, thank you, Emily Wooden from WHO and Aaron Wallace from the Centers for Disease Control in the United States. We are now, we went over time deliberately because we saw many questions from very active participants, and to honor that, Emily and Aaron accepted to stay over a few minutes. We realized also some people obviously had to go. We're glad our presenters and so many of you have been able to stay. Our goal is really to begin a conversation today. And as you can see on your screen, the next webinar will be taking place at the same time, but 11 days from now. So if you have your calendar in front of you or can go to it on your phone or your computer, make sure you have this time written down so you do not miss the third webinar. This is only the beginning of a conversation on how to reduce inequities and improve coverage for better immunization outcomes. For those of you who are scholars who are currently onboarding for the scholar course, we thank you for your attendance. It is very much encouraged that you attend all these webinars, because one of the first choices you will be making is which guideline are you going to work on to develop an action plan. So we encourage you to begin reviewing, if you haven't already, and thinking about which makes the most sense for you. And we hope the presentation has also been useful to that end. So I also want to acknowledge the many participants who are connected to the Facebook live stream. We haven't had a chance to acknowledge them. And most of all, thank you so much for joining today, taking time out of your busy schedules, of fighting the urgencies and the priorities that you have in front of you in vaccination where you work, to join us for this very special moment. We hope you enjoyed it, and look forward to seeing you on the 27th of May, together with Godwin Mindra from UNICEF, to discuss reducing inequities in the urban immunization context. Back to you, Emily and Aaron, to say goodbye this time, and thank you.
No, thank you very much to all of you for your active participation and for your interest in the subject. And I hope our paths will cross again in this area of work. Thank you very much. Thank you, everyone. Appreciate it as well.
Great. All right, goodbye to all, and thank you so much for your participation. This is a 6-webinar marathon, so don't let us down. Show your commitment to reducing inequities and improving coverage. Look forward to seeing you on the 27th of May. Take care and goodbye.